Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the osteology of the humerus. First of all, we'll go to the anatomical position and side determination. We'll go through the humerus. Humerus has upper end, lower end, and a shaft. Upper end has head, the lesser tubercle, the greater tubercle. It has anatomical neck, surgical neck, intertubercular sulcus here. Lower end is condylar. It is the medial epicondyle, the lateral epicondyle. Posteriorly, we'll get the olecranon fossa. Anteriorly, we'll get the coronoid fossa and radial fossa and pulley-shaped structure here. This is the trochlea and rounded part laterally. That is the capitulum. The medial border of the trochlea is around 6 millimeter lower than that of the lateral border. That helps in the formation of the carrying angle. Carrying angle when the elbow is extended and forearm is supinated will get the carrying angle laterally. Okay, so we got the anatomical position side determination. Let us show you that part. Okay, so upper end, lower end, head is directed upwards, medially and posteriorly. Okay, anteriorly we'll have the lesser tubercle of the humerus. Just lateral to that is the intertubercular sulcus or bicipital groove. Then lateral to it is the greater tubercle. We have the head and you have the anatomical neck here. Anatomical neck, attachment of the capsular ligament that extend a little bit down the neck. Okay, here. Then we have the surgical neck. This is the surgical neck. This area is the surgical neck. Okay, in the lower part we have the pulley-like structure, the trochlea, the capitulum, the lateral epicondyle, prominent medial epicondyle. The olecranon fossa posteriorly is located posteriorly. So this way we can hold in anatomical position and can determine the side of the humerus. Okay, let's go to the next slide. Okay, we got that. Okay, so we have just discussed that this is the lesser tubercle. Here is the insertion of the subscapularis muscle. Subscapularis muscle is innervated by the upper and lower subscapular nerve. Okay, this is the greater tubercle. We have 3 facets, superior facet, and we'll get a bit posteriorly get the middle facet, inferior facet for the attachment of the supraspinatus, the infraspinatus and teres minor muscle. This is the intertubercular sulcus for the passage of the tendon of the long head of the biceps brachii muscle with its synovial sheath and a blood vessel, that is the ascending branch of the anterior circumflex humeral artery. Okay, this is the lip of the intertubercular sulcus. This is the lateral lip for the attachment of the pectoralis major muscle, that is bilaminar attachment, and here is the medial lip for the attachment of the teres major muscle. In the floor we'll get the attachment of the latissimus dorsi. These all are insertion. Okay, these all are insertion. So insertion of latissimus dorsi, insertion of the pectoralis major, insertion of the teres major. So the usual mnemonic is that the one lady between 2 major, this is the pectoralis major insertion, the insertion of the teres major, in between them we have in the floor the latissimus dorsi. We have a ligament connecting the lateral lip, medial lip. There is the transverse humeral ligament. The surgical neck, very important for the relationship to that of the axillary nerve and posterior circumflex humeral artery. Okay, we got that. This is the head. It is covered by the hyaline articular cartilage in our life. This is the anatomical neck. Attachment also to the capsular ligament here, a little bit going down, and also there is some gap for the passage of the long head of the biceps brachii here. This is the intertubercular sulcus, also called bicipital groove, between the lesser tubercle and greater tubercle of the humerus. This is the anatomical neck. Okay, and this is the surgical neck. We got that. Okay, now here we have three facets on the greater tubercle of the humerus for three muscles. This is the insertion for the supraspinatus, insertion for the infraspinatus, insertion for the teres minor. Supraspinatus, infraspinatus innervated by the suprascapular nerve. Teres minor is innervated by the axillary nerve. Okay, we got that. So this is the surgical neck, and now the posterior aspect here we have the radial groove here. This is the radial groove for the passage of the radial nerve, and the arteria profunda brachii or profunda brachii artery or deep artery of the arm. Okay, that goes through the radial groove, also called spiral groove. Okay, here we got that. This is the head, we just discussed. Three impression on the greater tubercle. So SIT, sit muscle. Okay, if you write that, sit muscle. Okay, SIT. Okay, sit muscle. So this three muscle plus we have the muscle inserting to the lesser tubercle, that is subscapularis. So we'll get the sits muscle. Okay, this forms the musculotendinous ring around the shoulder joint. So supraspinatus, infraspinatus, the teres minor and subscapularis, they forms the fibromuscular band, fibromuscular support around the shoulder joint. So that is the fibromuscular tendinous ring around the shoulder joint for the stability of the shoulder joint along with other factors. Okay, so we got that. Now we'll go to the next slide. Here is the lower part of the humerus. You have to identify the structure again. We have the coronoid fossa. Okay, so here will be the ulnar coronoid process will be in relationship to that in case of flexion of the elbow joint. Okay, and this is the radial fossa for the radial head will come here in full flexion. This is the olecranon. This is the olecranon fossa. Olecranon fossa of the ulna will be there. Okay, in case of full extension. Okay, so we got this, the olecranon fossa here. This is the trochlea. This border is 6 mm lower than the medial border. That is essential for the formation of the carrying angle. Okay, CARRYING, carrying angle. Okay, we got that, and we have the medial epicondyle, which is more prominent than that of the lateral epicondyle. Medial supracondylar line, the lateral supracondylar line. Okay, this is the condyle. Okay, this is the epicondyle. We got that, and here is the trochlea. Trochlea here. This is the capitulum. This is the radial fossa. This is the coronoid fossa. This is the medial border of the humerus, passing over the medial supracondylar line. This is the lateral border passing along with the lateral supracondylar ridge here. This is the medial supracondylar ridge. This is the lateral epicondyle for the attachment of the superficial extensor muscle. Medial epicondyle for the attachment. Attachment means origin. Here, origin of the superficial extensor muscle. Medial epicondyle for the origin of the superficial flexor muscles. Okay, we got that. Okay, so we have gone through that part. Head covered by hyaline articular cartilage, we just discussed. Anatomical neck attachment of the capsular ligament, but capsular ligament goes little bit down from the neck, exact neck, going down nearly few centimeters. Okay, surgical neck has some clinical importance because it is related to the axillary nerve. Axillary nerve is coming from the brachial plexus, from the posterior cord. This is a and also this surgical neck is related to the posterior circumflex humeral artery. That is a branch of the axillary artery, for the third part of the axillary artery. Greater tubercle has three impressions. We discussed supraspinatus, infraspinatus, teres minor muscle, insertion. Supraspinatus, infraspinatus, teres minor muscle. These two muscles innervated by the suprascapular nerve. This muscle innervated by the axillary nerve. Lesser tubercle, insertion of the subscapularis muscle, innervated by the, it gets nerve supply from the upper and lower subscapular nerve. Transverse humeral ligament is a ligament between the lateral lip and the medial lip of the intertubercular sulcus or bicipital groove. Okay, they just make a breeze for the passage of the long head of biceps brachii, its synovial sheath, and ascending branch of the anterior circumflex humeral artery that is going through the bicipital groove, and it is covered by the transverse humeral ligament. Okay, we got that. Now we'll go to the next slide here. Okay, next slide here. Again, this is the joint. This is the glenohumeral joint. Okay, head is very large in comparison to the shallow, the glenoid cavity, and this cavity is increased by the presence of glenoidal labrum. This is a fibrocartilage ring around the glenoid. This is the glenoid cavity of the scapula. Okay, so it will be there, but still there is chance of dislocation. It is mostly dislocated inferiorly. Okay, we just discussed the transverse humeral ligament here. This is the tendon of the long head of the biceps brachii, and we'll get synovial sheath around it, and also the ascending branch of the anterior circumflex humeral artery is also a content of the intertubercular sulcus or bicipital groove. This is the long head of the biceps brachii. This is the long head of biceps brachii, and it takes origin from the supraglenoid tubercle of the scapula. Okay, we got that here. This is the bicipital groove here, and this is the origin of the brachialis muscle from the anteromedial and anterolateral aspect on the lower half of the humerus. And on the medial border of the humerus, insertion of the coracobrachialis. Coracobrachialis takes origin from the tip of the coracoid process. It inserts here. Its nerve supply is from the musculocutaneous nerve. Okay, we got that. Brachialis has dual nerve supply. It is innervated by the musculocutaneous nerve that is coming from the lateral cord of brachial plexus, and also it is getting innervation from the radial nerve. Okay, it is dual innervation. Brachialis is in our body is covered by the biceps brachii. Biceps brachii has two heads. The short head coming from the tip of the coracoid process. Long head is coming from the supraglenoid tubercle of the scapula, and biceps brachii is covering the brachialis. Okay, so it is also innervated by the musculocutaneous nerve. Biceps brachii inserting to the radius, to the radial tuberosity here, and also by bicipital aponeurosis. Underneath the biceps brachii, we have the brachialis muscle, and brachialis muscle is inserting to the cornoid process here of the ulna. Okay, here is the insertion of the brachialis. we got that. Okay. Here on the posterior aspect of the arm, here we have the muscle, lateral head of the triceps brachii. This is the medial head of triceps brachii, the long head of the triceps brachii. Long head is coming from the infraglenoid tubercle of the scapula. Between the medial head and the lateral head, we have the radial groove. And radial groove contains the radial nerve and the arteria profunda brachii or profunda brachii artery, or also called the deep artery of the arm. Okay, the triceps muscle inserts to the olecranon process of the ulna, and triceps muscle is very important for the clinical region. We hit here by reflex hammer, and we test the jerk, the triceps jerk, and the integrity of the nerve supply. The radial nerve supplies the triceps brachii muscle. Okay, we got that. Triceps brachii muscle here, 3 head, one, another one here. Okay, we got, this is the insertion. This is the triceps brachii, this is the medial head, this is the triceps brachii origin of the long head, triceps brachii origin of the lateral head. Between the lateral head of the triceps brachii origin and the medial head of triceps brachii origin, the radial groove for the passage of the radial nerve and the profunda brachii vessels, or the deep artery of the deep artery of the arm. Okay, we got that. Again, biceps brachii muscle, underneath we'll get the brachialis muscle, and here is the transverse humeral ligament covering this long head of the biceps brachii as a content of the bicipital groove. Okay, and this is the muscle coracobrachialis inserts on the medial border of the humerus. This is the coracobrachialis innervated by the musculocutaneous nerve that is coming from the brachial plexus, from the lateral cord of brachial plexus. Okay, we got that. Here is the pectoralis major muscle insertion to the lateral lip, and we have the latissimus dorsi to the floor of the bicipital groove, and teres major should be inserted to the medial lip of the bicipital groove. It is covered by these muscles here. Okay, we got that. Now we go to the next slide here. Again, bicipital groove. What is in the floor inserting the latissimus dorsi muscle, what is in the medial lip, teres major, what is inserting to the lateral lip, that is the pectoralis major muscle. What is the content? Content is the long head of the tendon of biceps brachii with synovial sheath and the ascending branch of the anterior circumflex humeral artery. What ligament bridges here? The transverse humeral ligament bridges here. This is the brachialis muscle coming from the anteromedial and anterolateral aspect of the lower half of the humerus. Okay, innervated by the musculocutaneous nerve and the radial nerve. Okay, here we have the deltoid insertion. Deltoid has big origin from the clavicle, from the acromion process, inserts on the anterolateral surface, almost near to the insertion of the coracobrachialis, but it is on the anterolateral surface. Coracobrachialis inserts onto the medial border. Okay, we got that. And here is the lateral supracondylar ridge for the origin of brachioradialis, extensor carpi radialis longus. Okay, and extensor carpi radialis brevis, and the common head of extensor, that is the common superficial extensor origin here. Okay, like here, common superficial flexor origin here, and here is the origin for the humeral head of the pronator teres. This is the medial supracondylar ridge. This is the lateral supracondylar ridge. This is the trochlea, this is capitulum, this is the coronoid fossa, this is the radial fossa. Okay, we got that. Okay, So we know the content of the intertubercular sulcus. Okay, shaft of the humerus, we have 3 border, 3 surfaces. Deltoid tuberosity a little above the middle of the anterolateral surface. We know the content of spiral groove, radial groove is the radial nerve and the profunda brachii vessel. Medial border of the humerus in the middle for the attachment of the middle border attachment of the coracobrachialis. Laterally a V-shaped manner, anterolaterally there is the deltoid tuberosity for the insertion of the deltoid. Okay, we got that. Now we found that here is the muscle. What muscle? This is the triceps muscle where it inserts to the olecranon process of the ulna. Okay, and we test the triceps jerk by hitting here. Anteriorly, we have the biceps brachii. We also assess the biceps jerk by hitting by a reflex hammer. There is the biceps brachii anteriorly. Okay, here we test the triceps brachii muscle. We have another muscle. There is the anconeus that coming from the posterior aspect of the lateral epicondyle. There is also a weak extensor of the elbow joint, and it is also getting innervation by the radial nerve. The triceps muscle is innervated by the radial nerve. Deltoid muscle innervated by the axillary nerve. It is chief abductor, extensor, even flexor anterior fiber. So this is the multipinnate muscle. Subscapularis is also a multipinnate muscle. Multipinnate because its fiber direction in multiple arrangement. So this is the multipinnate muscle. Okay, the deltoid and also the subscapularis. Here is the triceps muscle here, inserting here between the lateral head and medial head with the radial groove here. Okay, and we have the origin of the common extensor origin here. Here common extensor origin. Here also the origin of the anconeus here. Okay, we got that from the lateral from the lateral epicondyle. Okay, so if you go there, anconeus, to show you the anconeus, this is the anconeus origin also. Here's the anconeus inserts here. Okay, here's the origin and insertion here. Okay, we got that. Anconeus is a weak extensor of the elbow joint. Okay, we got that. Now we know the insertion of coracobrachialis. Medial intermuscular septum of the arm is attached to the medial supracondylar ridge, like that of the lateral intermuscular septum is attached to the lateral supracondylar ridge. This is the medial supracondylar ridge. Here is the medial supracondylar ridge for the medial supracondylar septum, lateral supracondylar ridge for lateral supracondylar ridge. Okay, we have the nutrient foramen little below the midpoint of the anteromedial surface here. It is not shown here nicely, and you must know that nutrient artery is a branch of the either brachial artery or it is a branch of the profunda brachii artery. It is important. It's the artery is directed downward. Okay, and the upper end is the growing end. Okay, so there is important nutrient foramen little below the midpoint of the anteromedial surface. We know the attachment of triceps brachii origin from 3 sides, from the infraglenoid tubercle, from the humerus, upper part of the radial groove, the lateral head, medial head below the radial groove, and insertion to the olecranon process of the ulna nerve supply by the radial nerve. Lower end has non-articular part. Non-articular part include the medial epicondyle, lateral epicondyle, the medial supracondylar ridge, lateral supracondylar ridge, and the radial fossa, coronoid fossa, and the olecranon fossa. These are the non-articular part of the lower end. Okay, so it is the non-articular part of the lower end. We got that. Now try here. Okay, so we got again triceps brachii muscle, the lateral head. This is the medial head, and this is the long head. Okay, here three muscle insertion: supraspinatus, infraspinatus, teres minor. Seat muscle. We'll add one S, that is the subscapularis muscle inserting here. This four muscle forms the musculotendinous ring or rotator cuff or musculotendinous ring around the shoulder joint. Okay, we got that. And here is the origin of the encomius. This is the origin of the common extensor tendon. This is the origin, the medial epicondyle common flexor tendon, especially the superficial muscles. Superficial common flexor, superficial flexor, and superficial extensor here. Okay, lateral epicondyle for the extensor. Okay, then brachioradialis takes origin from the proximal two-thirds of the lateral supracondylar ridge. Extensor radialis is attached to the distal third of the lateral supracondylar ridge. Okay, we just discussed lateral intermuscular septum of the arm is attached to the lateral supracondylar line. Brachialis originate from the lower half of the anterolateral and anteromedial surface of the humerus. Posterior surface origin of the lateral head here, lateral head, and here is the medial head of the triceps brachii. Brachialis originate anteriorly from the anteromedial aspect and the anterolateral aspect from the lower half of the humerus. Okay, we got that. Now, medial epicondyle, superficial site of origin of superficial flexor muscles of the forearm. What are the superficial flexor muscle taking origin from medial epicondyle? Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis. All of them innervated by the median nerve except the flexor carpi ulnaris, innervated by the ulnar nerve. Okay. We have ulnar collateral ligament medially, lateral epicondyle with the radial collateral ligament or lateral collateral ligament. Ulnar collateral ligament is attaching to the lower part of the medial epicondyle, going to the coronoid process, the olecranon process of the ulna, and that is triangular. Okay, and the lateral collateral ligament or radial collateral ligament from the lateral epicondyle of the humerus going to the annular ligament of the radius. Okay, we just discussed encomius from the posterior surface of the lateral epicondyle innervated by the radial nerve. Superficial extensor of the forearm, extensor carpi radialis longus and brevis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris muscle. Okay, they all are extensor muscle. They should be innervated mostly by the radial nerve. Okay, so we got the nerve supply of this muscle. They are mostly innervated by the radial nerve. Here, the radial collateral ligament, distal border of the lateral epicondyle. We just discussed that part. Okay, now ossification of the humerus, one primary center and 7 secondary centers. Upper end is the growing end. It will unite with the shaft around 20 years. Lower end will unite with the shaft by 16 years. Okay, and we have to know that our humerus is prone to fracture. Surgical neck of the humerus, the axillary nerve is damaged. If the shaft of the humerus is broken, then the radial nerve will be damaged. And this is the medial epicondyle. Posteriorly, it is related to the ulnar nerve. So any fracture of the medial epicondyle, ulnar nerve may be damaged. There may be damage to the supracondylar area, and that may involve the median nerve, especially in children. Any injury there may cause medial nerve injury, and we may have, due to those medial nerve injury or ulnar nerve injury, we may have Boxman ischemic contracture or ossificans myositis may happen. Okay, due to the lack of nerve supply to the muscle, and there will be calcification on the necrosed tissue. Okay, so we got, that's all. Okay, so, and that's all about the anatomy of the humerus. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.